Together we achieve victory over heart failure.
I'm Professor Smit Shrivastava from Cardiology Clinic, Raipur. And today we are delving into a silent epidemic that India is combating, the heart failure. In India, the majority of patients grappling with heart failure are surprisingly young individuals. It's a common occurrence to witness young adults seeking medical assistance for heart failure. Unlike the Western countries where the heart failure is predominantly a disease of elderly. Let's break down 5 essential insights on heart failure. Firstly, what does it mean when a doctor tells you you have heart failure? When people get a diagnosis of heart failure, they think it's end of their lives. The term heart failure can seem very frightening, but it simply means that your heart is struggling to pump as efficiently as it could. The ejection fraction or EF measures how well your heart pumps blood. It's the amount of blood pumped out of your heart's lower chambers, that is ventricles, each time they contract. While a normal EF is around 50 to 70%, individuals with heart failure can have as low as EF of 30% or even lower. Secondly, why are so many Indians affected by heart failure? Genetics plays a significant role. Indians are generally genetically more vulnerable to cardiovascular diseases, including heart failure. Furthermore, hypertension, obesity, diabetes, smoking habits, they worsen this epidemic. And as opposed to the Western population where smoking is going down, Indian population is seeing an increase in smoking and use of tobacco, smoker or non-smoking tobacco. Especially females in India are using more tobacco. Moving on, what are the signs and symptoms of heart failure? How will we ascertain that we are getting or we have started to have heart failure? Watch out for confusion, easy fatigability, heart palpitations, nausea, shortness of breath, and weakness. There can also be loss of appetite, even vomiting. How can we protect ourselves from this disease? Our heart incredibly works hard to keep us alive, and there are 5 golden rules that we can follow to return this favor. Firstly, early detection of heart failure through regular blood tests and even consultation. Dietary adjustment to maintain healthy heart, incorporating daily exercises to your routine, practicing stress management techniques, avoiding stress, or quitting alcohol, tobacco, smoking, or non-smoking tobacco. And lastly, the fifth element, what comes next after a heart failure diagnosis? Thankfully, medical science offers numerous treatment options. It is possible to lead an enjoyable, meaningful, and productive life. Heart failure medications improve your quality of life and even longevity. Devices like biventricular pacemaker, implantable cardio defibrillators, ICDs, heart valve treatment, or repair and management or replacement. As a last resort, the option can be heart transplant, which is also widely available. The lifetime risk of chronic heart failure is 1 in 5, male or female. So be aware, we can be proactive to take measures in combating this silent epidemic and not land up with those 1 out of 5, but land with those 1 out of 5 who do not develop heart failure. Thank you.